My name is Rukaya Muhammad Abdullah. I'm a nurse supervisor at MSF, Maiduguri, Borno State, Nigeria. This is our inpatient therapeutic feeding center here in Maiduguri, Borno State, where we treat children suffering from severe acute malnutrition under 5 years old. Most of them are affected by the conflict here in the northern part of the country. As you can see, this is our emergency room, where all patients that come to the facility have to pass through. The patients are categorized into either red cases or yellow cases. Those that are red cases are usually admitted into the intensive care unit. This is the intensive care unit. We have 18-bed capacity and a resuscitation bed. The patients here mostly are those that are red cases. That is to say, they are in either severe respiratory distress, hyperglycemia or hypoglycemia, and with dehydration. Majority of the patients here spend 3 to 5 days, depending on the outcome of their treatment. The patients here are mostly on intranasal oxygen and nasogastric tubes, because majority of them are either in respiratory distress or they cannot tolerate oral. This is the acute phase of the treatment of the malnutrition, where patients who are a bit stable compared to those in the intensive care unit are being admitted. The patients here do not have intranasal oxygen. Most of them are also being tested for plum peanuts. If the plum peanut test is positive, then the patients are moved into the other phase of the treatment known as the transition phase. This is the transition phase, where the patients, after passing through acute phase, do come. The patients here mostly spend between 1 to 3 days on admission. If the plum peanut test is, if they tolerate their plum peanut test, the patients are being discharged home. The patients here also do not have intravenous fluid, are not on oxygen therapy. This is our ambulatory therapeutic feeding center. Patients that are stable enough to be treated as outpatient are admitted here. Majority of them are on plum peanuts. At the transition phase, we give them 2 weeks. After completing, they come here for their routine follow-up and immunization.